Liver transplant. Surgery to remove a diseased liver and replace it with a healthy liver or part of one from a donor. The most common reasons for liver transplantation in children is biliary atresia, a disease in which the ducts that carry bile out of the liver are missing or damaged, while in adults the most common reason for a liver transplant is cirrhosis, a disease in which healthy liver cells are killed and replaced with scar tissue. There is no effective treatment for end-stage liver disease other than a transplant. The life of someone with kidney failure can be extended by dialysis, and someone with a failing heart can sometimes be sustained by an implantable pump, but there is no machines that can take over the liver's functions. Until such machines can be devised, until an animal liver can replace a human one, or until new livers can be grown from stem cells, there is total dependence on liver transplants. Liver transplant may be from cadavers or living donors and involve the whole liver, a reduced liver, or a liver segment. The donor livers in transplants were initially from cadavers. Donor livers from live donors are now in increasing use. Most transplants involve the whole organ. The reduced liver transplant may be done if the donor liver is too large for the recipient. In segmental transplants, a segment, often the lobe of the liver, is transferred from a living donor to a recipient. The first such recipients were children. Now some are adults. The liver segments in the donor and the recipient grow back to full size within about a month. The donor must be an adult capable of giving informed consent. The informed consent is not a simple bioethical matter because liver load transplantation is not risk-free for the donor. To determine who is in the most critical need of a liver transplant, the United Network for Organ Sharing UNOS uses a system in the U.S. that includes the model for end-stage liver disease MELD scoring system for adults and the pediatric end-stage liver disease PELD scoring system for children under 18 years of age.